Welcome to Wisconsin Doctors. I'm Jessa Jeremiah, and we are here at Upland Hills Health in Dodgeville. February is Heart Month, and we are covering some absolutely fabulous heart health topics that you're going to want to know, so stick around for the rest of the show. First, we're going to cover prevention. We're also going to talk about heart emergencies. Further, we're going to talk about what to do in the case of a heart emergency and actually learn some CPR. Then we're going to talk about rehabilitation if there has been an emergency that has occurred. We're going to be joined by 3 members of the staff here at Upland Hills Health. One is Dr. Charlie Pierce, who is an emergency physician. We're also going to talk to Lance Meritz, who is a registered clinical exercise physiologist, and Michelle Helen is an RN, first aid CPR instructor, and the staff development coordinator here at Upland Hills Health. It's all coming next on Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are here at Upland Hills Health in Dodgeville, and February is Heart Month. So we are talking heart health, all the way from prevention to what to do in the case of an emergency, and we're even going to talk a little bit about rehabilitation later in the show. We are here in the Heart, Lung, and Sleep Center, and joining us right now, we are starting with Dr. Charlie Pierce, who is an emergency physician, and Lance Meritz, who is a registered clinical exercise physiologist. So the first topic we're going to tackle with you two is lifestyle habits to promote heart health, so a little bit on the prevention side. So thanks so much for joining us today and having us here in your space as well.
You bet. Yeah, great to be here.
So Dr. Pierce, we're going to start with you a little bit. Talk to us first a little bit about your role here at Upland Hills.
Sure. So I'm an emergency medicine physician. So I work in the ER here in the hospital. I'm actually part of a larger group that we're based out of Madison. So it's called Madison Emergency Physicians, and we work at about 6 different hospitals in the region.
Okay.
Staffing just emergency departments. We don't staff anything outside of emergency departments. We're all board certified. And so myself, I work not only here, but I also work in Janesville at St. Mary's, and I work in Baraboo at St. Mary's as well, or St. Clair, excuse me.
Okay, excellent. So you're at several different locations, including here at Upland Hills Health. Lance, so as a registered clinical exercise physiologist, we got it all in, that's a mouthful. Let's talk a little bit, tell viewers at home what that is gonna mean in terms of your role here, kind of your day-to-day.
Okay, so Charlie's an expert in the field of like emergency management and triaging a lot of different cases that he has come into the ER. I specialize in the assessment, development, and then facilitation of treatment plans or exercise plans to help improve somebody's functional capacity, body composition, flexibility, and strength.
Okay.
So a lot of that, and my background takes into a lot of account the folks' different like chronic conditions, so diabetes, lung disease, heart disease, cancer, that kind of thing.
Right, okay. And how long have you been here at Upland Hills?
Just over 2.5 years now.
Okay, sounds good. So we've got 2 kind of different perspectives here in terms of talking about heart health and on health today in the industry. So Dr. Pierce, I know you've seen obviously your share of heart problems in the ER. Talk to us a little bit, later we're going to talk about how to manage those cases.
Sure.
So for right now, let's talk to us about factors that can actually contribute to these heart health issues.
Sure, great question. So the best way to look at it is you break it down into 2 categories. So there's the categories of things that you have control over, and then there's the categories of things that you do not have control over. So let's start with the latter first.
Sure.
So the things that you can control, things that you can't control in your life are your age. That's a big risk factor. As you age,
although we may wish.
As you wish, that's
yes.
right. But everybody gets older. If you're fortunate, you get older. The second thing you can't control is your genes. So those are something that are immutable. They don't change over time. You're born with them, you're stuck with them. And along those lines, gender as well. So gender is a big risk factor.
Right.
Men being much more likely to have heart disease and heart attacks than women.
Okay.
In terms of things you can control, though, that's a nice thing to focus on, is high blood pressure being one, so keeping your blood pressure good and controlled and normal. High cholesterol being another, so keeping your cholesterol well maintained and low. The next thing being smoking. So avoiding smoking, and if you do smoke, the sooner you quit, the better. That's a big modifiable risk factor.
Okay.
And then the last two are very similar, so inactivity. So lack of physical activity is a big risk factor for developing cardiac disease,
Right. Okay.
heart disease, and coronary disease in particular. And then finally, obesity. So increased weight is an independent risk factor for developing coronary artery disease.
Okay, really good tips. So obviously we can't control things like our age and genetic determinations, things in our family, but there's a lot that we can control.
Oh, yeah.
And we'll dive a little bit more into this topic later in the show. And Lance, before we go, talk to us a little bit about some of the things that we need to pay attention to. Let's talk briefly about a heart-healthy lifestyle.
Heart-healthy lifestyle, I mean, you hear lots of different diets and exercise programs and supplements. I think a heart-healthy lifestyle is a moderation lifestyle. So getting moderate amounts of daily physical activity. For most folks, you need to get at least 30 minutes most days of the week, but also remaining physically active the other 23 hours of the day.
Sure.
That's the big important thing. Moderation of what you eat too, so making sure that you get a moderate amount of fruits and vegetables each day, along with some water each day, minimal amounts of sweets and red processed meats or processed and packaged foods. All of that combined with good social wellness, so spending time with family and friends, huge for heart healthy, but also longevity lifestyles.
Very interesting. Okay, great. We're going to talk to you both in just a few minutes about some other important factors in terms of actual heart emergencies. So Lance and Dr. Pierce will chat with you in just a second. We've got lots more Wisconsin doctors coming up here at Upland Hills Health after the break, so stay right there. Welcome back to Wisconsin Doctors. We are here at Upland Hills Health in the Heart, Lung, and Sleep Center. We are talking about heart health as February is Heart Month, and we are still here with Lance and Dr. Pierce, and we're going to continue our conversation for just a moment about lifestyle habits before we move on to heart emergencies. But Lance, if you would, kind of expand a little bit more on some of the other habits that we can do to keep our heart healthy.
Heart healthy, you can do a ton of things. If you have less than one risk factor for heart disease, you could probably safely begin an exercise program. If you have any more than that or any family history, you should probably talk to your doctor just about, hey, am I okay to start an exercise program, or where should I begin? Start eating 2 servings of fruits and 2 servings of vegetables a day. The research has been incredible to show the effects that those have on reducing inflammation inside of our arteries. Goofy things like laughter. Laughter can reduce stress. That's a simple thing that we can just laugh more. Handful of nuts a day. That could give you up to 3 years of extra life expectancy with heart-healthy fats.
That's an incredible statistic. 1 handful of nuts can give you up to 3 years.
Yeah, 1 handful of nuts. Wow. Being with a committed partner in a positive relationship could also add up to 6 years of life expectancy. So if you're ever arguing with your spouse, think of that in the back of your mind, that maybe this is a good thing, not a bad thing.
Life,
yeah,
right,
adding to their life right now.
Yes.
But also making sure you stay hydrated, have a good social life, make sure you eat good, healthy things.
Yeah, and I love that these are things that we can do. So there are a lot of preventative measures we can take into our own hands for our heart health. That's great tips. Thanks so much. Dr. Pierce, of course, you have a lot of experience with heart emergencies. So let's turn our discussion for a moment to some of those things. And I think what viewers at home want to know, who, as you age, you start thinking about these things more and more, but is there a typical age group that you think are more at risk for heart attacks? And talk to us a little bit about when they typically occur. What is the more common times?
Sure, absolutely. So, as per our conversation earlier, one of the risk factors you can't control is as you age.
Right.
Your risk for having coronary disease or heart attacks goes way up. We know that if you look at a population-wide, when you're greater than 65, that's the most heart attacks and the most heart attacks that result in death. So greater than 65.
Okay.
However, go back 20 years in men, at the age of 45 and older, that becomes a higher and increasing risk of heart disease and heart attacks.
I see, okay.
Women, on the other hand, it's right around the age of 50, 55, really corresponding with menopause. So postmenopausal women start catching up pretty quickly with men in terms of their risk of heart attacks, and they get near equivalent once you get over the age of 65.
Okay, so there are definitely some age factors there and some differences, men and women.
Right.
Let's talk a little bit about when somebody does come into the emergency room here at Upland Hills Health. From the patient perspective, what can they expect upon arrival?
Well, if you come in with a complaint that's something like chest pain, for instance, that would be a high risk for heart or heart-related issues, you're immediately brought back to a room. So there's no wait in a wait room. You're brought immediately back into a room. A nurse will take you to that room. They'll put a bunch of stickers on you. These are called leads, and allows us to immediately get an EKG. And that's a way to electrically assess, so get a picture of the heart. It's not painful, but a picture of the heart that tells us if there's anything going on with the heart right in that moment.
Wow, okay, that's incredible. And let's talk a little bit about from the perspective of the healthcare provider. So here at Upland Hills Health, what kinds of things do the emergency staff, I understand there's a staff, they need to do things to kind of prepare for emergencies. You never know when they're going to occur, when someone's going to walk through that door. So what do they do?
Sure, so here at Uplands, Patty Hinderman, who's one of the nurse managers that oversees the emergency department, has done a really fantastic job and has been recognized statewide in creating a protocol and creating a culture of rapidly getting folks who are having a heart attack from this facility where we do not have a cardiologist and we do not have a cath lab where they can take a person and open up an artery that's closed. But so she's created a protocol and a culture that can rapidly assess folks and rapidly transport them from here, from this facility, to one of the 3 hospitals in Madison's where they have cardiologists and interventional cardiologists and a cath lab.
Wow, that's important. And narrowing that time span, I'm sure it makes an incredible difference in your ability to save people.
Oh, time is heart muscle. Yeah, so the longer duration of time that a person's got a blocked artery, a completely blocked artery, the more injury, the more damage, and the more potential irreversible injury and damage that happens to the heart.
That's incredible. Well, thank you so much, Dr. Pierce, for your insight.
You're welcome.
Lance, thank you as well. We're going to talk to you a little bit later in the show. When we return, we're talking to Michelle Helen, and she's going to actually teach us a little bit of CPR. Could save someone's life. We'll be right back with more Wisconsin doctors here at Upland Hills Health. Welcome back to Wisconsin Doctors. We are filming here at Upland Hills Health, and February is Heart Month, so we are talking about heart health all episode long. We have talked a little bit about prevention. We started our conversation about heart emergencies, and we're going to continue that conversation now, which is why we are on the floor. We're joined now by Michelle Helen, and Michelle Helen is an RN, a registered CPR instructor, and a staff development coordinator here at Upland Hills Health. And we're going to continue our discussion, like I said, about heart emergencies and turn it to CPR. So thank you so much for joining us.
You're welcome. Thanks for coming.
And we're going to actually learn a little bit about CPR. But first, let's talk a little bit about classes. Now, do you offer a class here at Upland Hills Health?
We do. We actually offer classes to both our employees and to the public.
Okay. And what kinds of classes are there for people who, viewers at home even maybe, that might be interested in taking a class? Talk to us a little bit about the types.
Sure. We have 3 types of CPR that we offer here. There's Basic Life Support, or BLS, for healthcare providers. That's the course that most of our employees take and could be open to community members who work for other healthcare organizations. Then we have Heart Saver CPR, which is a common course taken by the childcare providers, construction workers, tradesmen, other people who need a CPR certification for their job.
Okay.
And then there's Family and Friends CPR, which is open to the general public and is open to anyone who just wants to learn how to do CPR to help someone in need.
Okay, so great options for folks out there. Now, I've heard of hands-only CPR. Can you tell me a little bit about that and then kind of talk about when that would be used as opposed to the other type?
Right, so hands-only CPR is just doing compressions only or pushing on the chest and not doing the rescue breathing.
Okay.
It came about largely because people weren't administering CPR when someone had a cardiac arrest, because of the kind of yuck factors. They don't want to put their mouth on someone else's mouth.
Okay.
So hands-only CPR is appropriate with a sudden arrest that's witnessed, and it's an adult victim.
Okay, so adults only, and you have to have recently witnessed this happening.
Correct.
Okay, I got
So infants and children should still get traditional CPR,
Okay.
including breaths, and an adult who you find unresponsive,
Okay.
or maybe someone who wasn't breathing normally and didn't have a sudden collapse, someone who maybe was a drowning victim, a potential drug overdose, anybody who really wasn't breathing well before they had their cardiac arrest.
I see. But this is an option for, if they fit within those
Yep.
two parameters. Okay.
Yep.
Well, you're going to show us a little bit
All right.
So I'm going to learn some things. I'm very excited, and this is just an incredible skill that I think everyone should have. So thank you for sharing this. Now, what do we do?
All right, so just a few simple steps. You want to make sure that the scene is safe for you to rescue this person. You don't want to injure yourself, so the scene is safe. You're going to tap and shout, "Are you okay? Are you okay?
Are you okay?
Are you okay?" If there's no response and they're not moving, you shout for help and send that person to call 911.
Okay.
And then you remove the clothing so you can see the landmarks on the chest.
I see.
Put the heel of your hand down in the center of the chest, other hand on top.
Oh, I'm going to follow you.
Doesn't matter which hand.
It doesn't.
Yep,
Okay.
and just a little higher. There you
higher.
go.
Yep.
And arms straight and shoulders above, and you're
Okay.
going to push hard and fast on the chest. Go. So you're pushing at least 2 inches, and the rate is between 100 and 120. And you just keep pushing till
And
help arrives.
I feel like I'm pushing really hard, but
You-
that's what you need to do.
That's what we
right?
need to do.
Okay.
Yep.
Wow.
Okay.
This is incredible.
Good job.
So you're going, actually even a little higher than I would have expected too. So you're getting all the way up to you're covering just really those bones.
Yep, we want to
there.
stay on the sternum or the
Okay.
breastbone, which is in the center, and right between the breasts.
Okay. I'm going to do it again.
Okay, go.
It's
Good job.
really, thank you. It's incredible to actually do it and feel the amount of pressure that you put on, because I don't know that would be instinctual to put that much pressure on.
It's hard work.
Yeah,
doing
it
CPR
is.
quickly is hard work, and so you would just keep doing that until trained rescuers arrived and took over.
Okay, well, thank you. That's incredible, Michelle, Helen, for sharing that information with us. When we return, we are actually going to talk a little bit about rehabilitation. So we are taking it through all the way from prevention to rehabilitation. We're going to do that after the break. So stick around for more Wisconsin Doctors here at Upland Hills Health. Welcome back to Wisconsin Doctors. We have been filming here at Upland Hills Health, and we are here still in the Heart, Lung, and Sleep Center at Upland Hills, and we have been talking a lot about heart health as it is Heart Health Month, February, and we've talked about several different topics. If you're just joining us, we've talked a little bit about lifestyle habits. We've also talked about heart emergencies, and now we are moving on to talk about what you can do in terms of rehabilitation in the event of a heart emergency. So we have brought Lance Merritt's back with us, and thank you so much for rejoining us here. So Lance Merritt's, in case you missed it, is a registered clinical exercise physiologist with lots of experience here at Upland Hills. And we are in the cardiac rehab department. So walk me through what might happen to bring a patient here to see you. Why would they come see you?
We call it cardiac rehab, but we really do see a lot of people with heart disease, lung disease, pretty much any chronic condition. And so often we'll see folks after they have like a heart attack or a bypass surgery, valve surgery, or a lung diagnosis where they're short of breath, like COPD, emphysema, any sort of breathing disorder. Recently we started a cancer program as well, so if somebody has cancer, they're going through breast cancer, prostate cancer, colon cancer, we'll see those folks in here as well. So any chronic condition can benefit from coming into our facility here. We can offer some sort of rehabilitation to them.
Okay, that's interesting. So you cover a wide variety of health conditions, and you have a lot of programs in terms of cardiac rehabilitation here at Upland Hills Health. Talk to us about some of those.
Okay. We've got 2 different phases of cardiac rehab. Phase 2 would be cardiac rehab after somebody, the weeks following having a heart attack or bypass surgery or valve surgery. We also then have phase 3, and that's more of like an independent exercise where people come and use this more as a monitored exercise facility, almost like an Anytime Fitness or Snap Fitness. The benefit to coming here would be that we have staff that folks can ask questions or get help with certain things.
Okay.
We also have pulmonary rehab, and that's for those folks that have any sort of breathing disorder, so COPD, asthma, anything like that. And then, like I said, recently we started our cancer program for any cancer survivor that's recently gone through or is going through cancer treatment.
Okay, so a lot of different options for people to come use the facility. I noticed when we walked in earlier that there were a couple people here just working out and using the facility with, basically supervision, which is great. And let's talk a little bit, you also have some support groups. Did you want to touch on that?
Yeah, we've got a great support series that we more or less think of as an educational support series and not the hold hands, sing kumbaya series. And so often we do this each month on the second Wednesday of the month,
Okay.
on Wednesdays at 10 a.m., and we bring in a speaker. And so last month we brought in a stress speaker. The month before that we talk about fall prevention, different things that are applicable to our patients or participants here that they find interesting, not just support and how are you dealing, how are you coping with things.
I think that's great for people to know that, you know, you are here for people in terms of prevention. Of course, you're here for people in terms of emergencies, but you're here for people in terms of post-care all the way through support, because there's a lot that goes on when somebody undergoes a stressful or traumatic situation, including with the mind. So to take it all the way through to the end, I think is really important. Tell us a little bit about the kind of progress that you can expect to see for somebody who is coming here.
Okay. And speaking to that last point you were saying about caring for that continuum, you know, because people continue to think about how they're feeling. Emotional recovery is a big thing too. We have camaraderie here, and the camaraderie as far as progress really helps people too, because they can really bounce questions off each other. Oh, I'm dealing with this. Oh, I went through this. Did you have this surgeon? Did you have this complication? But as far as actual progress, we just got done doing our stats from last year, and we had about 50% functional improvements for folks. So we can see improvements in functional capacity, or what people are able to do, or decreases in shortness of breath, increases in their strength, decreases in their weight, increases in their muscle mass. All of these are really great things. It sometimes just takes, unfortunately, a scary event for somebody to come into a program like this. But we do have great services for folks that haven't even gone through a traumatic experience like a heart attack or bypass surgery. And that's what we call our phase 3 exercise program, that anybody can basically come in so long as they have any risk factor for any chronic condition, basically.
Okay. Well, Lance, thank you so much for sharing this with us. This has been an incredible journey for me in learning, and I hope for you viewers at home as well. February is Heart Month, and we have gotten a lot of great tips all the way from prevention to post-care from you folks, the great folks here at Upland Hills Health, so we thank you.
You betcha. Thank you.
Thanks to all of our guests for joining us. Thank you so much for watching. I'm Jessa Jeremiah, reminding you to live longer, live better, and that's it for Wisconsin Doctors.